talking about euthanasia and physician-assisted suicide. It's something that not a lot of people know about just because of its low-lying presence in the United States at this time, but due to increasing amounts of illnesses that cause people to seek this out, it's becoming more prevalent. Though I'll be using euthanasia as a general term, there is a difference between euthanasia and physician-assisted suicide. Euthanasia is when a doctor physically administers drugs that will end the patient's life, whereas physician-assisted suicide is when a doctor writes a prescription for the patient, and then the patient is able to take those drugs at home in the comfort of with their families outside of physician care. So that's why sometimes a lot of people prefer that, because once they get that prescription, they can then change their minds or take it whenever they need. This is Dr. Jack Kevorkian. He emerged in the late 20th century because he was a doctor who started practicing euthanasia on patients who requested end-of-life assistance. He did it for multiple people and then was charged with second-degree murder in 1999 and sentenced to jail for 8 years and died shortly after his release. He is credited for bringing euthanasia up as a topic and sparking a lot of debates about the topic. Okay, so circumstances that lead to these people seeking this is shown in this chart. As you can see, 79% is due to people getting certain types of cancers that limit their life quality and add a lot of problems and pain due to those tumors being present. These are the reasons why people are beginning to seek the lethal medication once they're given those diagnoses. The top being the loss of their autonomy and being less able to engage in activities that they once normally would be engaging in. And at the bottom here you see the financial implications being only at 3%, meaning that people are doing this because they don't want to be in pain anymore, not because they just can't afford the treatment. This graph shows people in Oregon who have, between 1998 and 2013, who have received a prescription, shown by these gray ones, and who actually died because of the lethal medication, shown in the green. As you can see, even though the number of prescriptions is increasing, there's also an increasing gap between the people who are getting the prescription and the people who are using it. This relates back to the convenience of being able to change your mind if you are not comfortable with it, or if things change later down the line and you're able to get more treatment, you don't have to take it, which is why some people prefer this over the euthanasia, where you have to go to the doctor and he prescribes it right there. Next we'll talk about where in the United States it's legal. In Washington, Oregon, and Vermont, there is ballots that were received and put into law, making it so that people and doctors could not get legally punished by prescribing these medications. In New Mexico and Montana, court rulings decided that physicians could not be prosecuted criminally if they were to administer these drugs. However, the one in New Mexico is currently being appealed. So as you can see by this chart, there's not very many states in the United States that provide this, which causes a lot of people to move into these areas to be able to do that. This map shows in green the states that are legalized, and then in blue the ones that have ballots rising and being taken into consideration. There's 15 of the states across, and the ones in white haven't had any legislation brought up in the past year. This is important because it's important to know about euthanasia and physician-assisted suicide so that you are well aware of these laws being put into place, and you're aware of how they might affect you or anyone that you may know down the line in the future.